name is Emily Buckley. I'm going to be your nurse today, and your name is?
Shane Sutton.
Nice to meet you, Mr. Sutton. So I just wanted to let you know that we are going to be doing a physical assessment of you today. It's going to take approximately 20 minutes. Do you have any questions?
No, ma'am.
Okay. If you have any questions at all during the process, please let me know. This whole assessment and anything you say is going to be confidential and private. And I did wash my hands before entering the room. So first off, we're going to do just a few questions about memory. So it's going to test your recent remote. We're also going to gain perspective about his LOC and then attention span and things like that revolving with your orientation. So your LOC, what is your full name?
Shane Thomas Sutton.
Okay, and what year is it?
2019.
Perfect. What year were you born?
December 12th.
Or I said year. When was your birthday? That's what I meant to ask.
December 12th, 2000.
Perfect. All right. So, patient is alert and oriented ×4. Patient is able to finish thoughts. There's no wandering, so his attention span is appropriate for the conversation. He's able to make eye contact, and it's appropriate and comfortable. The speech is clear and understandable. How are you feeling today?
I'm feeling good.
So the patient's feeling good. The mood is appropriate. He is dressed appropriately, and his facial features are appropriate for the situation. He's calm and cooperative. Alrighty. So then I'm going to do the memory. So we have recent, and then we also have remote. For the recent memory, I'm going to ask you to do a recollection or just repeat what you had from breakfast all the way until your last meal over the last 24 hours. Okay?
Okay. I had sausage and biscuits for breakfast. Then I had a corn dog for lunch. Then I had steak tacos.
Okay? Alright. So his recent memory is intact. For the remote memory, I'm going to ask you 4 unrelated, or I'm not going to ask, I'm going to tell you 4 unrelated words, and then I'll ask you to repeat them back at some point during the assessment, okay? So, the 4 words, first one is ball, then cat, toy, green. Okay, can you go ahead and just repeat those back to me right now?
Ball,
Uh-huh.
cat, toy, green.
Yep. Had to think for a second. Perfect. So we'll do that again later on just to see how well you were able to retain that. That's going to test your remote memory. So we also took your vital signs. Pick up this piece of paper. Just put down. We did your vital signs before the assessment. So blood pressure was 118/72, right arm sitting. Heart rate was 76. His pulse was equal bilaterally. Respiration was 16 unlabored. Temperature was 97.3 orally. And then, so his vital signs are within normal limits. Are you in any pain?
No, ma'am.
Okay, so patient denies pain at this time. So now, I'll set that there. So now I'm going to do an assessment of your skull and your face. So first of all, his skull is normocephalic. There are no lumps, lesions. His hair is evenly dispersed, dark brown and thick. It is, there's no excessive dryness or moisture in his hair, and it is without parasites. So, perfect. Any tenderness?
No, ma'am.
Okay. So that was the skull, and then we'll move down to the face. So then the skin is uniform. There's no abrasions, no lesions, no scaliness, dryness, or extra moisture. The skin is warm and dry. So the eyes are located on the top third, nose is midline, and the lips are located in the bottom third of the face. So then I'm going to be doing an assessment where I'm testing one of your cranial nerves. It's going to be cranial nerve number 5, and that is the trigeminal. Hope I said that correctly. So I'm going to take a cotton ball here, and I'm going to have you close your eyes, and then I'm going to touch you on different parts of your face, and when your eyes are closed, I want you to describe what part I'm touching. Okay? So you can go ahead and close your eyes. Okay?
Left cheek, chin, nose, forehead, right cheek.
Perfect. So the trigeminal nerve is intact. So that's cranial nerve number 5. And now I'm going to have you clench your jaw several times, and I'm just going to feel right here. Okay? Go ahead. Perfect. So I had him clench his jaw, and I felt his masseter and temporal muscle. There was equal and strong contraction bilaterally. All right. So now I'm going to test another cranial nerve. So what I'm going to have you do is close your eyes, and I'm going to use my fingers to try to pull open your eyes, and you're going to resist it. Okay?
Okay.
Yes, and you can take your glasses off for the procedure. So this is going to be testing the facial nerve, which is nerve 7. Okay? Perfect. So cranial nerve number 7, the facial nerve, is intact. And then I'm going to have you smile. Perfect. So there is no drooping or facial discrepancies when the patient smiled. Next, I'm going to check your nails. So the patient's nails are rounded, translucent. Cap refill is less than 2 seconds. And then the angle is less than 160 degrees. No clubbing present. I'm also going to check his toes while I'm here. So the cap refill is also less than 2 seconds. The nails are translucent and pink and rounded. And then no clubbing present, and less than 160 degrees also for the nail angle. Sorry, the cat is very loud. So now we're going to move back up to the facial region. We're going to do an assessment of your eyes. Okay. So on the face, we have eyebrows present, equal bilaterally. The hair is coarse, dark brown, no scaliness, no excessive moisture, no lesions. We also have eyelashes present on both eyes, and they're everted. Yes, looks good. The sclera is white. So the conjunctiva is pink bilaterally. So now I'm going to test some of the extraocular motor nerves of the eye. My handy dandy pen light. So to do this, I'm going to hold the pen in front of your face, and I'm going to move the pen, and what you'll do is you will need to follow it. Okay?
Okay.
So start here. Concentrating. So the extraocular motor nerves that we were checking were cranial nerve number 3, which is oculomotor, cranial nerve number 4, which is trochlear, and then cranial nerve number 6, which is the abduction. And then those are intact. There was parallel tracking with the eyes as I moved the pin, which is appropriate and within normal limits. And then we would normally, with an eye exam, do the Snellen test, and a description of that is to have the patient stand 20 feet away from a picture or sign. It's usually those signs that have varying sizes of text, and the patient reads the text, the smallest one that they're able to read at 20 feet away. And while they're reading that, they'll cover one eye with one hand and read with just one eye, so the right eye, and then switch over to the left eye. We'll close my eye on that one, so the left eye. And they would do that at the 20 feet away mark. And then 20/20 vision, of course, is normal. He wears glasses, so he would have them on and he would read at a distance, and then he would also take them off and read at a distance, and we would test both of those. So now I'm going to dim the light. I'm going to do an assessment of your pupils. So the light is dimmed. And before we dim the lights, his normal pupil size was really dark. His normal pupil size was about 6 millimeters. So with dimming the lights, I shine the light into his eye, and the pupils constricted bilaterally. It was appropriate and within normal limits. And then now to test accommodation, what I'll do is I will have you look at an object, so I'll use the pin light, and then I'll have you look past it when I tell you to, okay? So you can turn a little bit more towards me. Okay, and I want you to look, can you look up just a little bit? Thank you. I want you to look at the pin light, and then I want you to look at that picture on the wall when I tell you to. So pin light, picture on the wall behind me. Okay, so accommodation is present, and then he has pupils equal, round, reactive to light, and then accommodation present. So all that is intact. If we were going to use an ophthalmoscope, cannot pronounce words, ophthalmoscope. If we were to use that, it's a device that helps see the back of the eye, helps visualize the retina, it helps to diagnose with certain eye diseases, kind of like glaucoma. And if we were going to be using that, we would be looking for the red eye reflex, which is considered normal. So now, after the eyes are finished, we're going to move on to the ears. So, patient's ears are equal bilaterally. The ears are elastic and there's immediate recoil bilaterally. Any tenderness or pain when I was palpating your ears?
No, ma'am.
Okay. And then I'm going to use my pin light to examine inside, and I'm going to pull the pin up and back for adults. Okay, so there are no foreign bodies present. There is no discharge. And there is no discharge or foreign bodies bilaterally. All right. No tenderness. Good deal. So then I am going to test a cranial nerve, where I'm going to do a whisper test. So I'm going to stand on one side. You'll cover one ear, and I'm going to whisper a 2-syllable word, and you're going to repeat back what you heard, and I'll do it again on the other ear, okay? So we'll start on this side since I'm already here. So cover the other ear, the right ear. Okay?
Strawberry.
Perfect. I'm going to come to the other side, and I'm going to have you cover that other ear. Perfect. And then I'm going to say a 2-syllable word. I forgot. Okay. Oh, almost said it too loud. Now I'm not going to say that word anymore. Okay.
Clock tower.
Perfect. I was just trying to give you the word. I wasn't even trying to whisper it. So that was testing the cranial nerve number 8, which is the vestibulocochlear. And that is intact because he was able to hear on both sides bilaterally whispering. So now, if I were to use an otoscope on his ear, it would be, I'd be able to visualize small bones in his ear. I'd be able to visualize the tympanic membrane, which is also your eardrum. So I'd be able to see if there's any ruptures or anything like that. I'd also be able to visualize foreign bodies that way too. If I were to be using that, it would use light, and you'd just be able to see further into the ear than just with the pen light that I'm using here. And now I'm going to examine your nose. So I talked about it and your nose started to.
Yes.
So the nose is midline. There's no deviation. I'm going to palpate. I'm going to tell me if you have any tenderness.
Okay.
Do you mind taking your glasses off? Thank you, Mr. Sutton. Any tenderness?
No, ma'am.
Okay, so there's no tenderness present. And then we're going to be testing a cranial nerve here. It's going to deal with your sense of smell. So again, we're going to have you close your eyes. You're going to hold one finger up to your nose, and you're going to smell something. I want you to describe what you smell, and then we're going to do it again for the opposite side. Okay? So go ahead and close your eyes and cover your one nostril, and I will have you smell this. Make sure I can smell. All right, go ahead and sniff.
Smells like mint.
Okay. And then the other nose for me, please. Okay, go ahead and sniff.
Smells like lavender.
Perfect. So that was cranial nerve number 1, the olfactory nerve, and the olfactory nerve is intact because the patient was able to sniff using both nostrils, so nares are intact. All right. So now we have done eyes, nose, ears, and we're going to move to your mouth. So the lips are symmetrical. They are pink. There is no breakage, no lesions, no dryness. And again, we tested the facial drooping. There was no facial drooping present. So now I'm going to do an examination using my pen light on the inside of the mouth. Do you mind opening your mouth for me? So the teeth are white and in good repair. The hard and soft palate are pink and continuous. Can you say "ah" for me? The uvula is present and midline. Tongue is present. It is pink and it has slight white coating. Okay, you can put your tongue back in your mouth. Just smile for me. Okay, his gingiva is pink and intact. There are no lesions. There's no bleeding or swelling. Do you have any tenderness or pain in your mouth?
No, ma'am.
So no tenderness or pain in his mouth, and then no tonsils are present, and so let me see. So his hard palate is pink and has transverse rugae. I really can't pronounce words. Rugae, and then his soft palate is also pink and softer. Those are continuous. And then with this one, we're testing the cranial nerve number 9, which is the glossopharyngeal, and then also the number 10, which is the pneumogastric. And so, do you mind opening your mouth and sticking out your tongue? Perfect. Perfect. And say ah for me.
Ah.
So the uvula, to test that, the uvula goes up and down midline with phonation. That is within normal limits. And then, can you lift your tongue up for me? The tongue on the ventral side, veins are present, and it is pink. Saliva is present also. So, oh, here I have a tongue depressor. I actually got it from work to use. I'm going to do one last inspection of your mouth,
Okay.
if that is okay.
Yes, ma'am.
Perfect. Okay. Perfect. I don't know why I put my pen light up. Say it off for me. Perfect. So that's handy in kind of keeping the tongue down if you're examining the back of the throat with the tonsils and everything. And we'll throw that away. Alright. So now I'm going to move on to chest, shoulders, spine. So, I'm just going to feel if you have any tenderness, let me know. So, no lumps, no lesions, no tenderness present. Skin turgor is resilient and elastic, less than 2 seconds. Now for your neck, I'm going to test your range of motion. So I want you to go forward with your head and then backwards. Okay, and then I want you to rotate it in a circle. Okay, and then I want you to go side to side. So range of motion is intact and appropriate. There was no crepitus noted. There's no pain. Upon palpation, no crepitus. Okay, and then I'm going to press down on you and you're going to resist. Okay? So equal bilaterally and strong, and that was testing cranial nerve 11, which is accessory. So then we're going to feel lymph nodes. Okay. Can you turn your head that way for me? Okay, turn your head the opposite way for me. So, no lymphodepathy. There is no edema or swelling of the lymph nodes. I cannot say those medical terms. So, excuse me. And then I'm going to go ahead and feel your carotid, and I'm going to listen to it also. Okay, one at a time. So the carotid pulse is equal bilaterally and strong. And now I'm going to listen to it. Okay. There are no bruits present, and bruits would indicate a narrowing of arteries. So now I'm going to listen to your lung sounds and R&D test of your chest. Okay. I'm going to have you turn in the seat here. Perfect. Can you scoot up for me? So breath sounds are equal and clear, bilaterally, posteriorly. I'm going to listen to the front now. Okay, so the breath sounds are clear, bilaterally, anteriorly, and then I'm going to listen to him laterally. Okay, so the lung fields are clear. There's no adventitious sounds. And then, so I'm pressing. And resonance is noted, which is normal. So now the last step is to teach you how to do a breast examination. For the breast examination, you will want to do it in 3 different positions and examine your breast. You can do it with your hands raised over your head, on your sides here, and then the last one. Oh yeah. Bending over like that. Well, yeah. So like that. So it's going to put the breast in different positions to see it from different angles. What you're looking for that are is abnormal is striae, lesions, any increase in vascularity, any lumps. The areola should be darker in color. They should be averted. You can squeeze the nipples, and if there's any see if there's any discharge. You're also going to want to be mindful of the lymph nodes in this area. You're going to want to check the lateral, posterior, the central, and the anterior. And this is in the axillary area, which is kind of under the armpit. And then the way you can test it palpating, you can go in like a spoke. You can go vertically, or you can do it in a circular motion, and just do it equal for each breast. You could even do 2 different methods if you wanted. It's just as important for men to examine their breast for any abnormalities just as women. So I think that's it. Thank you so much.